Lynn Chaplesky, and I'm an oncology nurse. An oncology nurse specializes in the care of patients with cancer. Today's presentation is about cancer. What exactly is cancer? Cancer is a group of diseases that originates from one cell or a group of cells that becomes abnormal and grows quickly out of control. These are called cancerous or malignant cells. Cancer cells are different from normal cells in the following ways. Cancer cells multiply out of control. For example, if a person fractures a bone, normal cells grow to repair the damaged area and stop growing when the bone has healed. Cancer cells continue to grow and multiply without stopping. Cancer cells look different from normal cells under a microscope. The internal structure of the cell is different, abnormal. Cancer cells have the ability to spread to other organs or tissues. This is called metastasis. Cancer cells can invade the blood and the lymph systems in the body. Cancer cells grow more rapidly than normal cells and can divide while traveling through the body. Cancer cells require more of the body's nutrients than normal cells. And finally, cancer tumors or growths can develop their own blood supply. It is estimated that 1 out of 3 people in the United States will experience cancer in his or her lifetime. Who is most likely to develop cancer? First of all, the older a person becomes, the higher the risk of developing cancer. African Americans have a higher risk of developing cancer than other populations. There are also social and economic factors which contribute to the risk of developing cancer, such as those who have a low level of education, people who do not have health insurance, those who have no transportation or do not have access to the healthcare system. Genetics has also shown to play a part in the development of cancer. This means that a person has an increased risk of developing cancer if a close family member has cancer, such as a parent or a sibling. What causes cancer? Cancer is caused by the exposure of the inner structures of normal cells to carcinogens. Carcinogens are substances or agents that can damage the cell's DNA. Known carcinogens or cancer-causing agents include certain chemicals, such as tobacco products and secondhand smoke. Some viruses have been linked to cancer. Radiation is another carcinogen, either from X-rays or from exposure to the sun. One physical cause of cancer is asbestos, and another is wood dust. Some foods and diets can contribute to the development of cancer. A diet high in fat and low in fiber may cause colon, rectal, or breast cancer. Lastly, in some women, hormone replacement therapy has been associated with the development of breast cancer. Before cancer is detected, 10 or more years may pass between exposure to the cancer-causing agent and the development of cancer. Many types of cancers can be prevented. 60 to 70% of all cancers have been shown to be associated with behaviors we can control. So how can we prevent cancer? First of all, a diet high in fresh fruits and vegetables and low in saturated fats can reduce the risk of certain types of cancer. Maintaining a healthy weight reduces the risk of breast, colon, and other cancers. Moderate exercise, at least 30 minutes, 5 or more days a week for adults, is very beneficial in fortifying the body's natural immune system to ward off cancer. Another method to help prevent cancer from developing is limiting exposure to the sun, starting from childhood. The use of sunscreens, sunglasses, hats, and other clothing protects the skin from damaging rays. Lastly, but maybe most importantly, is by not smoking. 1 out of 5 deaths each year is caused by cancer. There are programs to help people stop smoking, offered through the American Lung Association, the American Cancer Society, and most hospitals throughout the country. It is important to prevent young people from starting smoking in the first place, and banning workplace smoking and smoking in public places can reduce the exposure to secondhand smoke. The earlier cancer is discovered, the easier it is to treat people and potentially cure cancer. The 7 early warning signs of cancer can be remembered by thinking of the word caution. These signs tell us we need to be checked by a physician. C is for a change in bowel and bladder habits lasting more than 2 weeks. A is for a sore that does not heal. U is for unusual bleeding or discharge. This includes rectal bleeding, blood in the urine, or bleeding from the eyes, ears, nose, or mouth. Vaginal bleeding in premenstrual girls and women past menopause warrants attention by the physician. T is for a thickening or lump in the breast or elsewhere. I is for indigestion or difficulty swallowing lasting for several days for no obvious reason. O is for an obvious change in a wart or mole, changes such as an increase in size, a change in color. A wart or mole that becomes itchy or irritated or starts to bleed should be noted. N is for a nagging cough that does not go away. If any of these signs are discovered, it is important to see your doctor. If cancer is found, how can it be treated? There are 4 general ways cancer is treated: chemotherapy, radiation therapy, surgery, and biotherapy. The goals of cancer treatment can be cure of the cancer, control of the cancer, or palliation, which means relief of symptoms. Some cancers are best treated with chemotherapy. Chemotherapy is a cancer treatment using special drugs that kill cancer cells. There are over 50 chemotherapy drugs in use today. These drugs can be used alone or in combination with other drugs. Chemotherapy kills cancer cells anywhere in the body they may have spread. Chemotherapy is commonly administered through a vein, intravenously or IV. Some chemotherapy drugs may be taken by mouth, and there are other ways chemotherapy is administered. Chemotherapy drugs may be a hazard to healthcare workers who are exposed to them if protective garb is not used. Gloves and a disposable gown must be worn when handling bodily fluids such as urine, vomitus, or other fluids. The gloves and gowns must be discarded after each patient use or when soiled. Eye protection should be worn if a spill or splashing could occur. Precautions for handling bodily fluids should be used for at least 48 hours after chemotherapy is given. Precautions for handling stool should last for 7 days after chemotherapy. A toilet should be flushed twice after patient use or when disposing of urine or stool for up to 48 hours after chemotherapy.